Thank you everyone for joining us for the Social Media and Doctors Ethical and Legal Boundaries webinar. Without wasting any time, we'll move on to the start. It gives me great pleasure to welcome Dr. Vinay Purohit, Deputy General Manager, Medical Services at Lupin, and I welcome him to give the introduction and welcome. Over to you, sir.
Thank you. So, hello everyone. A very good evening to all of you. I'm Dr. Vinay Purohit. I'm a pharmaceutical physician by profession and a clinical pharmacologist, and currently working as a Deputy General Manager in Medical Affairs Department of Lupin Limited, which is one among top 5 research-based Indian biopharmaceutical organizations. It gives me immense pleasure to extend to you a very warm welcome on behalf of our entire Lupin team and Integrated Academy Society of Clinical Oncology in this special webcast on social media and doctors, ethical and legal boundaries. While social media has the potential to truly improve health behaviors, awareness on specific aspects of common health problems and patient outcomes, the use of social media in the healthcare settings raises a number of issues, including concerns related to privacy and confidentiality, professional boundaries, recruitment, the integrity, accountability, and trustworthiness for both healthcare professionals and genuine patients. With the need to understand these issues holistically, along with ethical and legal boundaries in the use of social media by doctors, Dr. Purvish Parikh has come up with a great idea to address these challenges by bringing together the renowned experts on the subject. Yes, it's a great privilege of ours that we have among us Dr. Purvish M. Parikh, who is the brain behind this unique initiative and who will be driving today's program as a moderator and actor. Though he doesn't need any introduction, but I will take this opportunity to say a few words about him. He's the Chief Advisor for Mumbai Oncocare Centers, Director of Precision Oncology and Research in Asian Cancer Institute. He is ex-professor and Head of Medical Oncology in Tata Memorial Hospital, Mumbai. He is Executive Director for Indian Cooperative Oncology Network, Founder, President of Asian Cardio-Oncology Society and Integrated Academy Society of Clinical Oncology. He has served as past President for SARC Federation for Oncologists and Indian Society of Medical and Pediatric Oncology. He is Emeritus Editor for South Asian Journal of Cancer, International Journal of Molecular and Immuno-Oncology. He has been founder member for Board of Director, Asian Oncology Society, has authored more than 19 books, 36 chapters, and more than 200 plus scientific articles. I also welcome our guest, Dr. Amy Caruso Brown, who is joining us from US. Welcome, ma'am. Dr. Ajit, Dr. Sumant, Dr. Randeep, Dr. Vineet, Dr. Ghanashyam Biswas, Dr. Amish Vora, Dr. SP Somashekar, Dr. Anil Singh, Dr. Indu Bansal, Dr. M. Vamshi Krishna, and Dr. Bharat Patodiya. So with this, I would like to hand over this session to Dr. Purvish Parikh. Over to you, sir.
Thank you very much, Dr. Vinay. It is now my pleasure to introduce to you Dr. Amy, who is our keynote speaker. And all of us are very eager to listen to your expert advice and recommendations. Dr. Amy, as you can see, is the Interim Chair, Center for Bioethics and Humanities. He's Associate Professor, Center for Bioethics and Humanities, Department of Pediatrics, Division of Pediatric Hemato-Oncology, Sunny Upstate Medical University, USA. And we are all just wanting to hear you and then ask lots and lots of questions to you. Over to you, Dr. Amy.
I'm going to go ahead and share my screen. Give me one moment. All right. So my hope today, because this is a huge topic for 30 minutes, but I hope that at the end of it, you will maybe have a slight change in perspective on this subject, or at least from the many different ethical questions I'm going to put out there, and I won't be able to answer them all, have one that you are really interested to explore or think about further. I don't have any financial or other conflicts of interest. I am not quite a lifelong social media user. my parents were very tech savvy. So I have had computers and internet access since I was fairly young. I've had a Facebook account since 2003. I'm slightly embarrassed to admit that, but I think it's important to know I use social media, and that is where I'm coming from. I have also had really positive experiences with social media, and I'm going to talk about one of those. I'm also going to talk about a really negative experience I've had with social media in the healthcare space. But that is for you to sort of know where I'm coming from when I talk about this topic. And I've done quite a bit of qualitative research with families, mainly parents of children with cancer, parents of children with other serious diseases, and with their physicians, looking at how they think and talk about social media in the healthcare space. So today, in the next half hour, I'm going to talk first about what makes social media different from older or more traditional ways of communicating between each other as professionals, between patients and healthcare professionals, and between patients and others in their disease communities. I'll give you a taxonomy that we have created looking at ethical issues that occur at the intersections of social media and cancer. And then I'll talk a little bit about oncologists' professional responsibilities to address these issues. And I hope that is what you will go on and talk about quite a bit more. Social media is somewhat unique. And I tend to think about all the different forms of healthcare communication, including offline communication, written communication, phone calls we may have with patients, conversations in our clinical spaces, but also the conversations they're having when they go home with other family members, with people in their community who are involved in health and healing. Under that, we have all of the digital communication. So that can include reading healthcare related articles in newspapers, looking on websites like WebMD or Medline. And then below that, we really have health-related social media use, which is really a distinct form of digital communication. This is the definition I have used most often in my research, that social media is all of the websites and applications that enable users to create and share content or to participate in social networking. And the key feature is really that creation and sharing, that rather than just obtaining information, people are producing and exchanging information online. This graphic gets bigger every time I look for an update. There are far more sites than I personally have ever used or even ever conceived of before I started diving into this. And I quickly realized that I'm getting out of date. I don't use TikTok regularly. My son does. And if I keep doing this research, I'm going to have to try to stay more on top of the hot sites and the new ways people are creating and sharing information. This is a snapshot from July 2021 of social media use around the world. So there's an estimated 4.5 billion active social media users, so more than half of the world. It continues to increase every year. Most people access social media on mobile phones at least some of the time. And the average amount of time spent per day on social media is almost 2.5 hours. So that is fairly significant, and I'll talk about why that's important in a moment. I think it's important to think about who's connecting with who on social media, and I'll criticize in a moment how the medical literature, the academic literature, has really narrowed their focus to interactions between patients and their healthcare providers, or sometimes patients and other people in their family. But there's so much more happening there, and I think it's important that we don't forget there's organizations and not just nonprofit groups, but also industry, pharmaceutical companies. All of these groups have social media presences too, and they're sometimes interacting with our patients and their caregivers. They may be interacting with us as physicians. Some of our patients may be contacting new healthcare professionals that they didn't have a previous relationship with. Many of our healthcare institutions have social media presence as well. So all of these groups are interacting with each other, and it can be a one-way interaction or it can be a back and forth. What are people doing online? Patients are often seeking information, but they're also looking for material or financial support, and they're looking for psychosocial support and connection. And that part is particularly important when we think about the benefits. This is from one of my first studies, looking at all the different ways social media can affect the encounter that we have with a patient or a family in a clinical space. And this was a pediatric study. So it says parents, but this would really apply to anyone, any patient. And so before the visit, they might be using social media to look at reviews of physicians online or to talk about the reputation of particular clinics or hospitals with other families. They might be Googling or looking up information or asking on Facebook about their child's symptoms or a new diagnosis that their child has. And they might just be looking for support or to hear about other families' experiences online. What did your child feel with the tests that we have scheduled? Things like that. During the visit, they might ask us about our opinion of information that they found online, or they may come ready to ask for a particular intervention, a particular test, a particular treatment that they've heard about. And they can become during that visit more or less anxious based on the information we give and how we respond to those questions. They also, and this is particularly true in my field, pediatric oncology being relatively small, they may ask about the care of other patients that they've met online or even met in real life, but that they've connected with and heard about, which poses some challenges for us in terms of confidentiality. And afterwards, they may go online and post a review. We've had people do that from our waiting room, sharing their opinion of the visit with others informally. They may check our recommendations with their social circles, with a Facebook parent group, with Twitter, with other people online. And depending again on what they find out and what was said during the visit, they may be more or less able to cope with the diagnosis and adhere to treatment. They may find supports online that actually make it easier for them to follow our recommendations. For patients, social media can be a journey, and not everyone goes through the full journey, but for many people, it starts as information seeking and then moves into the space of interaction and support, ending with patients becoming advocates for their disease. And what really sets this apart? So one piece is that patients no longer need to actively seek out support groups, even online. Social media use is so much a part of so many people's regularly daily activity that it's easy to fall into those groups. You go on Facebook after you're diagnosed with cancer and tell someone, and suddenly 100 people respond with their words of support and their experiences and invitations to join groups. And that happens in a very natural way that doesn't necessarily require patients to do anything differently than what they were doing before they got sick. As I mentioned earlier, they're creators, producers, and managers of information. They're not just recipients. And the information they're getting is just in time. So it's immediate, very often. There's always somebody online somewhere in the world. It's targeted to their specific concerns. So the advice we give in clinic may be targeted to the patient's concerns, but we often give some advice that is generic, or we give all patients who are newly diagnosed with this type of cancer. But when they go online, they can ask about what's worrying them right now and only get advice about that. And it's tailored to their role, whether that's the role of parent, the role of caregiver, or their experience as a patient. So they're not getting advice that is across the board. They're getting advice for people in their position. And finally, social media platforms do democratize information. So our patients can come to us much more knowledgeable and informed than ever before. And around the world, we're really hearing and seeing that this is starting to shift towards more patients being willing to challenge their physicians, either in the clinical space or in terms of what they do when they go home. Other benefits. So you can control the pace of the information you find online, though many families tell me it can be overwhelming, but they do have the ability to turn it off, to shut it down, to not look anymore, where very few of our patients, at least in most cultures, are willing to tell us, wait, I just can't hear anything else you're saying right now, please stop talking. Most patients will hear us out. Even if they don't want to, and even if it's very stressful because we're giving them too much information for where they are in their disease experience right now. Many patients are more willing to ask questions that they may have labeled as dumb or ignorant, or be reluctant to ask a physician for fear it will reveal all they don't know or how uneducated they are, or that it'll waste the physician's time, that our time is valuable and we shouldn't spend it explaining very simple concepts to them. But they might be more willing to ask other patients or other families online. And other patients and families may be more equipped to provide pragmatic advice. So in my space in pediatrics, families often have questions about feeding or sleep during treatment for which we don't really have good evidence. There's not a clinical trial or a study I can point to that says this is exactly what you should do while your child is being treated with cancer to help their appetite. I can recommend drugs for nausea. I'm not necessarily as good at saying, oh, adding a little ginger really helps, or some of this advice that families have told me they get from other families online. So that may be a more useful space for those questions. And the families who are able to produce and share that information benefit psychosocially. So they may feel better. They may feel a greater sense of agency or more control in an otherwise really uncontrollable situation by being able to share their experience and help another family. And from many studies, both parents and adult patients who use social media for health information report feeling more empowered, feeling a greater sense of control and competence, feeling better equipped to advocate either for themselves or for their children. And at least in adults, they may have better adherence or compliance with treatment and even possibly improved health outcomes. What are the benefits for us as physicians? So there's lots of ways we can use social media too. One of them is continuing education. And I'll come back to this idea that we can learn from patients and from families themselves online. We can learn from their experiences and their journeys. We can learn from other healthcare professionals, either in our field or in other fields. There's opportunities for professional networking, and not just traditional career networking or finding a job opening or things like that, but also finding enhanced referral options for patients, making a personal connection with another physician that then makes it possible to refer your patient to them, and finding solidarity and social support in the same way that patients find support online. Physicians, particularly through COVID, have found social media to be a space in which they can find support and validation for their experiences. And there's also opportunities for advocacy, whether legislative advocacy or just promoting public health and health literacy. And there is so much of this happening right now in the COVID space and around vaccination and things like that. In an ideal world, social media would enhance our relationships with our patients by giving us a common vocabulary to start from, aligning expectations about what medicine is and does, and ultimately increasing confidence in our recommendations. It can build scientific literacy and even the scientific knowledge base that can contribute to research. It can validate personal experience of physicians and of patients, and it can raise awareness and promote support for research, for community programs, and for policy. Now, that's the ideal world, but let's talk in the next few minutes about the ethical issues. So these are the four groups that we've created through our research, mainly in the pediatric space, but I think they apply across the board. The first is privacy and confidentiality. The second is equity and resource allocation. The third is misinformation and mistrust. And the fourth is professional boundaries. And most of the work has been in the professional boundaries space. So this is a selection of headlines from medical journals, which really focus very much on professionalism and on the behavior of physicians themselves online, sometimes in interactions with patients. And I really think that this misses the most interesting and complicated space and some of the greatest ethical challenges we face. So why are we concerned about patients going online? Four big concerns: misleading, inaccurate, or false information. But I would point out, this is clearly a concern. There is clearly a lot of misinformation online, and there is ways in which social media algorithms are set up to perpetuate that information, to make, clickbait, things that just make you want to click on it, even if it's not true, and then encourage sharing of that information. And unfortunately, when we asked parents how they assess the validity of information, seeing it in a lot of different places was one of the #1 things they cited. Although we know that just may mean it's very compelling false information and not true information. But this is a study of Facebook posts of parents of children with cancer from a few years ago, and about 2/3 were medically accurate. I think that's not terrible. I would like it to be higher, but I think it's not terrible. But the other concern is that addressing that misinformation can be really time consuming. And it can take time out of a visit that we don't have, that we have relatively short time with each patient. And there's often really important things we need to do or ask in that space, which can be totally overtaken if a family or patient is coming in with a lot of misinformation we need to address. We worry that too much information will overwhelm families, and several studies have shown that the most common advice given by physicians to patients is just to not go online for precisely that reason, though patients often don't listen to us. We worry about sharing in ways that compromises our patients' privacy or safety, maybe particularly so in pediatrics, where children don't necessarily have a say in what their parents post online about them. And we worry that that information will come back to cause negative consequences for them later on. So that someone, when they go to get a job, when they go to apply to college, when they try to get health insurance, that having all of this medical information online will come back to lead to negative consequences for the child in some way. Even a future marriage partner Googling and finding the blog post that they wrote. And finally, I think the shift in power is uncomfortable for many of us. And there's also several studies, including this one's a systematic review, that looked at disapproval and found that patients who felt that that shift was uncomfortable and felt disapproval from their physician then tended to be deceptive, to not disclose that they were getting information from social media, and they tended to leave more dissatisfied. Why should both us as physicians, but also our patients be concerned about us going online? The overemphasized one is that it may encourage the formation of personal relationships that violate professional boundaries. I don't worry about that any more than I worry about any other professional boundary violation. Again, I think it's a smaller piece of the puzzle and really the less interesting piece. We worry that physicians may either search for or share patients' information in ways that violate patients' privacy and confidentiality. And at any time that you spend on med Twitter, you will very quickly see physicians sharing things that the patient probably wouldn't be pleased to know was online. And it's often not done in a way that the patient is identifiable, but there's still that tension of knowing, are we writing something that is available for public viewing that our patients would really feel betrayed if they knew we had done that? And in addition, our patients do criticize us online. I hear from a lot of physicians who think that this is really unfair, that they have no recourse when they get negative evaluations, that they're not allowed to write about patients online, but patients can write anything about them. And in the US, they can name them. It's pretty hard legally to challenge that. And we know that reading those criticisms may actually negatively impact our behavior and may then affect the quality of care we provide unintentionally. We worry that physicians may share our own information in ways that undermine patients' trust in individual physicians or in medicine itself. And as with the first one, I think this is the smaller piece. I think more often we are allowing false perceptions of medicine and misinformation to stand. I think that's a much bigger problem for trust in medicine than the problem of a few physicians posting something that might be perceived as unprofessional. And finally, even when we exchange information amongst ourselves, we can still be wrong, can still be misleading, inaccurate, or false, and that's a problem if we then act on that information. So the core ethical questions, and I would encourage and invite anyone who's interested to consider any of these for further research, writing, or exploration, because I think they are all relatively unanswered in the ethics literature, and I have opinions on them, but I don't think there is a consensus yet. So in the privacy and confidentiality space, who gets to decide whether a patient's healthcare information is shared online? To my knowledge, not many countries have protections for children or for patients who lack capacity, adult patients who lack decisional capacity, are say unconscious or intubated, to stop their family members from sharing information. When, if ever, should we seek additional information about a patient or family online? Many adolescent and young adult doctors ask me about this because they are interested in seeing what their patients are doing online, in that it often reveals behaviors that are impactful in the healthcare space that would affect the patient's health or their ability to comply with recommendations. How do we respond when our patients ask questions that's based on information shared by another patient or family? Or really, how do we respond in a way that addresses the patient in front of us without harming the confidentiality of the other patient? And what do we do when we realize a patient is in our online social circle? I think that question, though, is not all that different than what do we do when we realize a patient is in our social circle anywhere. One of my first, I moved back to my hometown after fellowship, and one of the first children I saw diagnosed with leukemia was in my son's music class. So I think that is not such a unique to social media problem. In the boundaries space, what do we do when patients invite us to connect on social media? And I'll talk a little bit more about the benefits of that in a moment. How should we respond when patients and families come to us with information about us that they found online? In the equity space, how do we balance visit priorities when time is limited and our patients have lots of questions related to social media? Who in healthcare is really responsible for providing patients with education regarding how to use social media? I think that education is tremendously important. And does social media really level the playing field, or does it just, as I think we think in the US now, exacerbate existing disparities? That for every patient who enhances their health literacy online, there are several more who were very health literate, very affluent, very well connected to begin with, for whom social media simply allows them to be more well connected to other hospitals, to second opinions, to things like that. And finally, for misinformation, what is our responsibility to address misinformation online? And how is that misinformation spread driving mistrust really in medicine more than individual physicians? And finally, how do we resolve disagreements that are driven by social media or may even be going viral and getting public or even worldwide attention, as we've seen in cases like Charlie Gard's in the UK? How do we resolve those when social media is really making them even more entrenched or intractable between physicians and patients? So in my last few minutes, I'm going to do two different cases that I hope will highlight the positive and the negative. This is a case from my hospital, one family, one hospital, and 12 months on Twitter. And this is a family who experienced an early complication due to a medical error, which led to a lot of anger. And the father started tweeting things like this. Can any idiot be a nurse? It's 8 a.m. and I've already made the medical assistant cry. Let's see if I can get someone fired by noon. Sometimes borderline threatening, but never explicit and targeted in a way that would be legally actionable. But through all of these, about halfway through this process, my colleagues discovered the Twitter feed, and it created an atmosphere of tremendous stress where people were really having to actively resist checking it because they wanted to know, what's he saying about us? What's he saying about our hospital? Everyone in our community can see this. And we were lucky in that this did not go nationally viral, but there were certainly people in our local community who were following it, and lots of feeling amongst the staff that it was creating a really negative environment, that they dreaded going into the room. And eventually this patient transferred to a new hospital. There was a point in here where the relationship really broke down irretrievably. And I think that this really highlights one of the negative sides in an unusual way about what happens when we bring social media directly into the healthcare space. It's not all negative, though. For many patients, including to some extent this family, social media really seemed like the only recourse to address very real problems. But on the other side, I think it gives us insight into our patients' perspectives. And sometimes that can be critical of us, but it can also be positive in a way. It can let us see what families misunderstand about what we've suggested. It can let us see our own behavior as it's perceived by others. It can lead to changes in how we interact and ultimately make our clinics and hospitals more friendly spaces for patients. And this was one of my early social media interactions. This is a family I took care of when I was a fellow, a family of a child with leukemia. And this is from her medical record about an event in which she was at home with morphine for pain. It was at the end of her life. And she came in unresponsive. Her parents had given her Narcan to reverse the effects of the morphine at home, after which she returned to her baseline mental status. That's how we described it in the chart. And we validated her parents for doing the right thing. This blog on the other side, and for the sake of time, I won't read it through, but I'll share these slides, but it describes the sheer terror her parents felt during this interaction of seeing their daughter stop breathing because of a drug that we had prescribed and that they had given, and of not knowing what was going to happen, of seeing her then begin to start screaming after they reversed the Narcan because she was in so much pain, and of sort of the utter grief of these parents who were going through this knowing that their child was dying. And when I read this, I thought, I had talked to them in the moment. I took care of them in the moment. I never appreciated it in a way that I appreciated it when they shared their blog. It expanded my thinking about what it is like to be a cancer patient in a way that no direct conversation I had had up until that point or really since had. It was almost like doing a house call or a house visit. It was a window into their life that I would not have gotten any other way. So finally, I'll just wrap up with some advice from parents of children with cancer who have told us, and this came from our most recent study. We had 90 parents talk about their experiences using social media and their advice for physicians. And I'll just highlight a few of these. The first was the openness, that it was important to them that we be open to asking questions, them asking questions and raising concerns, that we be honest about what we know and don't know, because they do check what we say on social media. And it's not personal, but it's a way of working through what they understand or don't understand. And that by being honest, they can trust us more. They suggest we think about using social media to understand their perspectives, but being cautious, taking care of ourselves when we go online. They also suggest just being okay, that sometimes it's okay if they'd rather look up what we said rather than asking for further explanations. This is a way of exerting control and agency. And they encouraged us to work with our hospitals to develop more guides and education around this. So finally, how should we respond? I think we need to accept the things we cannot change, and that's increasing social media use. I think we need to take the phrase, just don't go online, out from our repertoire for both patients and for our students. And I think we need to move away from framing this as an adversarial relationship. There's a lot, at least in US-based social media, a lot of memes about your Google search versus my medical degree. And I think that sets up antagonism that actually isn't there for patients and shouldn't be there for us. And of course, I think we all need to use our privacy settings and encourage others to do the same, because letting everything be totally out there is not safe for anyone. And finally, we can learn a lot from following our patients on social media when we do it with care. It does open up a new world for our patients with great potential for benefit, but also for great risk. And I think we have responsibilities to help guide them, and not just our individual patients, but really all of our communities through this world. In the absence of an active physician presence online, others fill the gap, and that's very often with misinformation. So I will stop there. I hope I have given you something to think about and explore further.
Thank you very much, Dr. Amy. That was highly insightful. And we have several questions for you. Will you allow us to show them to you?
Yeah, absolutely.
Okay, so you can read the questions on the slide in the screen. This is a question: if wrongly or due to personal reasons, if a patient writes an adverse comments, can any legal action be taken against them?
Not, so I am most familiar with the US and the UK for legal systems. A little bit easier in the UK where they have stricter libel laws. And I don't know if enough of your legal system is British inherited to help you with that. In the US, it is extremely difficult, really almost impossible to get those negative reviews taken down. Again, unless they're threatening or contain hate speech. So for instance, if someone wrote something about a doctor that referred to the doctor's race or ethnicity, that would probably be able to be taken down as hate speech. But just, this was a terrible clinic, I waited forever and then they gave me stupid advice, that's not coming down.
Same situation in India as well. The next question is from Dr. Arman Reza. He is saying, is it okay to present a case and discuss possible plans on social media?
I recommend, though you can do it in a de-identified way that doesn't include the patient's name or identifying information, I recommend asking the patient for permission to do that. The answer is often yes, because patients like the idea of crowdsourcing advice. They largely are excited to know that we are consulting with a larger group of physicians and getting more input on the case. It makes them feel good. It makes them feel like we're thinking about them and spending time on them and that they're valuable.
Right.
So it's an easy thing to do. And then it takes the pressure away from, I think I de-identified it, but what if someone reads it and can recognize them? And in Europe, the standard for publishing cases is that the family member or patient should not be able to recognize themselves. So it's stricter than it is in the US.
Right. The next question about advertisement we'll take during the panel discussion. Can you go to the next one, please? This is again from Dr. Arman Reza. Sometimes people share new interventions done by him or their facilities through social media. Is it legal to boast about such things?
It's definitely legal. It has consequences in terms of what other patients ask for. And I think we need to use some caution and to talk to our patients about what might happen when they do this, or what might happen when we advertise our own services, which I know you're getting back to. But yes, legal, yes.
Right. Thank you very much. I think, there is one more question from Dr. Kusum. What are the precautions one should take while images of patients or intraoperative pictures are put on social media? I think you have partially already addressed this, but if you have any more comments on it.
Yeah, again, I encourage asking for permission. Some of our consent forms contain a provision for using images for education, but I think it's an ethical stretch to say that education means public posting on social media. We know that's not what most patients think it means. They think it means a grand rounds or a morbidity and mortality conference.
Very true, very true. So Dr. Amy, once more, thank you very much. And I'm sure that since you have shared your Twitter handle as well as your email, you're going to be bombarded by questions, comments, and requests from our participants.
That's okay. I would love to hear from you all. So
right, great. We can move to the next part of the session. And that the first one is, may I invite Dr. Ajit Venniyoor, Senior Medical Oncologist from Muscat, to share some good, useful, and happy experiences on social media regarding medical practice and patients. Over to you, Dr. Ajit.
Thank you so much, Purvish, sir, for this kind invitation. I have my social media presence on Facebook, or Meta as it's called now, I think, Twitter, LinkedIn, and WhatsApp. But most of my interaction, in fact, all my interaction with patients occur on WhatsApp, so I'll stick to that. We do have a professional interaction on WhatsApp as well, because all our tumor board cases, rotas, drug availability, these are all discussed in the hospital on WhatsApp groups, but I'll stick to my interaction with patients. After Purvish sir asked me about this, so I just my WhatsApp group, list to find out how many patients I have on my WhatsApp, active patients, and that's only about a dozen. But one of the reasons for such a small number is that a lot of patients here don't speak, or their carers don't speak English. Most of them are comfortable with Arabic. So I asked my interpreter, actually, Sister Jamila, who assists me, and she's got a huge number, maybe about 3 to 4 times as many patients on her WhatsApp, contact list, who is constantly bombarding her with questions. Let me first of all say that I don't voluntarily share my WhatsApp number with the patients. Most of them ask for it and say, we'll contact you only in emergency, and we tell them, look, only in emergency, and contact us only during working hours, because your data is on the computer and you can access it only then, and always share your Royal Hospital sticker ID so that we can access the correct patients. And this is generally adhered to. So in a day, I get about maybe not more than 2 or 3 of WhatsApp requests, and but Sister Jamila gets maybe around 15 to 20. It keeps coming throughout the day, and we are sitting in front of the computer and answering most of them. Most of the interactions, in fact, I would say we never had an unpleasant interaction so far. Most of them have been useful interactions. The commonest query which comes is about appointments. Can the appointment be changed? We missed the appointment. Can you get a fresh appointment? Especially after this recent cyclone, we had lots of queries in correcting the appointments. The second commonest is about reports. And that's, I think, one of the really useful thing about WhatsApp. The patient comes in the morning, gives the blood for testing, say she's on palbociclib. She collects the medicine, goes home. She doesn't have to wait. She goes home after in the evening or something, or in the afternoon, she sends a message on WhatsApp saying, what's my report? Can I start the medicine? And yes, you can say yes or no. And the same thing goes for, say, a scan, a CT scan or MRI. So the patient has appointment today, next appointment is 3 months later, but she has a scan done about, maybe say, a week later. She gives a WhatsApp message saying, look, my scan has been done. What is the outcome? And we reply, oh, it is good. You can come in your scheduled appointment. Oh, it's terrible. Come immediately. So that really saves a lot of time, saves a lot of worry, reduces anxiety. I think it's a very happy situation for all of us. Few of them do ask about new symptoms or side effects of the medicines, and we never give medical opinion on WhatsApp. We always tell them go to the nearest health center, or come to the emergency immediately, and you'll be seen there. We try to avoid giving medical information on the net. The irrelevant information do come sometimes. They send me updates on some new paper on their disease, or some person even sends me religious texts. We ignore all of that. We don't encourage it. We don't comment on that. So overall, my experience so far has been excellent. I think it really saves me a lot of time, saves the patients a lot of time. It reduces the footfall in the hospital. They really need to come in much less. And overall, I think it's a very positive thing. I think communication is one of the essential pillars of medical treatment. It's well known that patients' complaints increases once they are very much in picture and they are interactive, and they know there's a responsive doctor or a medical professional on the other side. So this in good old days, it used to be the telephone, and telephone has a big disadvantage. The time is not of your choosing. With WhatsApp, you can choose your time to respond, and in a time and a place of your choosing. That really doesn't trouble you at all. You can choose to answer it the next day. So that has been really positive so far. And I think, yeah, that's about it. My experience so far has been really positive. Of course, I'm not on other doctor rating system, pages, so I really wouldn't know anything about it. Thank you so much, Purvish sir.
Thank you very much, Ajit. This was very important to know about your experience from Muscat. And now we move on to the next rapid fire, and that is by Dr. Sumant Gupta, who is a senior medical oncologist from Faridabad. And from him, we would like to hear the opposite side of the coin, and that is how to tackle bad social media remarks made by patients. So Sumant, over to you.
Thank you, sir. So I'll take the other side of it. Can I have the next slide, please? So if you have bad social media publicity, so how do we handle it? So the first and foremost thing in this, what I will say is, do not panic. Do not be very hasty on the buttons. And so do not press the button immediately. Do not reply immediately. Plan, respond. But again, the most important wonder word is do not sit back and do not delay it. Next. We are very active on social media. Most of us are very active on social medias nowadays. Most of us have teams. So we should always have a proper team. So you may take the lead, but you should have a proper social media response team. That should be a makeup of your facility. For example, you might have a doctor or a nurse, or if you are in a bigger setup, in a hospital-based setup, you should have a proper team. There should not be multiple voices. It should be a team effort who should always be responsive for a negative publicity, and the messaging should always be consistent. Next, please. there should always be a plan crafted. So it should not be a panic reaction. See, all of us will have a positive side of social media. There will be always a negative side of social media. Social media is something which is now embedded in our personalities, which is embedded in our practices. Purvish sir has always been guiding us, telling us that this is part of our life. So there should be a team which should be ready. So we should, most of us, it should be a spinal reaction nowadays, that most of us know what kind of reactions will be, because most of us who have been practicing, we know that most of these responses are most of the time the patients react to the bills when their bills are high, or most of the time when the patients do not get responses from a junior member of our team or someone from our nursing staff, billing staff. So we have to be very clear to the person role, and there should be no confusion in the response of these answers. Next, please. Again, like I said, the prompt reply. So what happens is social media does not take weekends off. So whenever you have a comment on your social media platform, whether it's a FB platform or whether it's a Google review, please be prompt in reply. Do not take days to respond. So whenever there is a negative impression, there are people who are continuously reading your social media. So do not be in a haste, but definitely the reply should be done maybe in 24 hours or 36 hours, but do not sleep on it. Do not think that today is a Friday, I'll respond, the team will respond on Monday. So whatever your team is there have to be a timelines to the response, maybe 12 hours, 24 hours, 18 hours, whatever it is. So whoever is the team leader should know that all the threads are being continuously reviewed by people. So the pro tip is, unless the comment is a very profane or incredibly offensive, please do not delete it. There should be a response to it, but deleting responses or deleting this can sometimes offend the person who has written the response. So most of the time there should be a proper, clear response to the negative comment. No, never try to be never try to delete all the negative responses. Next, please. Stay positive, try to strike a balance between friendly and professional remarks, and never respond with anger or defensiveness. Next one. Be very straightforward. Be very direct in your responses. You want the community to trust you, and be honest in building the response and trust. Never try to dilly-dally your responses, and this will always show, because most of the people who are there, most of the patients nowadays who are coming, or most of the people who are coming, they review through the whole of the threads. It should not be one or two, because most of us know that when there are 50 or 60 remarks in it, most of them will be 5 stars, 4 stars. So one or two negative remarks will not be a negative deterrent to the patient who's coming to you. Next one, please. Most of these negative comments, always respond. One or two responses should be there. Do not try to elongate the conversation. Take this conversation to a private channel if necessary. You can always respond like a simple response. Yes, what is the name of the patient? You can take or ask for his number very politely, and then your team or whoever is looking after your social media platform can take that conversation to a private channel and a DM, and then the conversation can go on, and the patient's whatever his or her problem was, or the attendance problem was, can be taken to a personal channel. Next. And as I said, if it was a very profane or a very, very irritating response, then we can always communicate with the social media platform like Google or Facebook to delete that remark, because most of these have managers who keep looking. And if the remark is very, very irritating, they also take care of it, because such kind of a defamatory remark is always removed by the platform. Next one, please. So sticking to the time, I'd like to end my talk with that social media is a double-edged sword. We all want the positive ends of it, but definitely in our lifespan, we will always get the negative edge of the sword also. And I want to thank Purvish sir for giving me this opportunity. Thank you, sir.
Thank you very much, Sumant. I think you made the best use of the short time available to you. And I like this double-edged sword that we should always keep in mind. Thank you. Can we now move to the next one? And that is none other than Dr. Randeep Singh, Senior Medical Oncologist from New Delhi. And his topic is on WhatsApp, display picture, and teleconsultation in India. Over to you, Randeep.
Good evening, sir, and I hope I'm audible and the slides are visible.
Yes.
Okay, thank you to Purvish sir and Kavina Creations. In the interest of time, I will start directly. The two topics which I have to discuss is how to manage your WhatsApp DP, and I will add to that a status and a very, very brief about teleconsultation. Teleconsultation in itself is a complete topic for a webinar. So when we come to WhatsApp, yes, WhatsApp is the social media. We can't think that WhatsApp is not social media and Facebook, Twitter, and LinkedIn is social media. That is very wrong. WhatsApp is definitely a part of social media. Whatever the rules apply to your FB, it also applies to your WhatsApp. How you portray yourself on WhatsApp. And I think in WhatsApp, apart from the text, what is visible to the patient is DP and your profile, which we definitely neglect. I think at least I have been neglecting it before I thought, sat down and made these 3-4 slides that yes, the profile pic is as important as it is in the Facebook. So few suggestions and tips which I could gather sitting down to my mind. Your profile pic can be screenshot by anyone and it can be misused by anyone. Like Facebook setting, WhatsApp also have an account setting where you can go to privacy and you can make your access to your profile pic limited. We always think that only Facebook we can do this. No, in WhatsApp also you can limit the access to your profile pic. Only if you have saved someone number in your contact, they will be able to see your face. They will be able to see your WhatsApp pic. Others like patients and others will not be able to see your profile pic. You have to remember that even if the image is deleted, somewhere down the lane, it is saved in some engine, some iCloud somewhere. And one of the best things to remember is whatever is there on WhatsApp or social media can be someday in the newspaper, and we have to keep our personal life private online. Posting your own, if you want to post your own pic as DP and it is open to anyone, then the rules are that it has to be presentable, formal, it has to be a forward headshot, it has to be updated, there has to be right expressions with a slight smiling face, simple background, no group photos. You may prefer to use your brand pic, hospital or clinic name in place of your personal photo. Status can help you to convey important professional info about yourself, and WhatsApp status can help you convey important info to your patients. So a change in the working place, you can use the status. Any important services you have started in your clinic or in your hospital, that can be used. Like I remember when we started this teleconsultation, most of us actually used the WhatsApp DP and profile very beautifully about the how to get in touch with the doctor or how to do the teleconsultation during the COVID time. Now, coming to telemedicine practice guidelines, yes, there are proper guidelines. These are the guidelines who have been presented in March and then updated recently. The Ministry of Health and Family Welfare, MOHFW, is fully committed to implement telemedicine. It was planned to implement these in December until 2022, but because of COVID, one good thing has happened that telemedicine has come full blown quite early. We may use teleconsult for routine follow-up visits, monitoring for chemotherapy toxicity, second opinions, telepathology, teleradiology, follow-up of bone marrow transplants, monitoring of patients, giving a tumor board approach where we can't meet together, but a surgical medical radiation oncologist can meet virtually and give a joint consult to the patient. So definitely teleconsult in oncology is here to stay, and it has much more bigger horizon than we each can think of. It can be a teleconsult can be between a patient and the health worker. It can be by the attendant or caregiver and health worker. And even a teleconsult can happen between two healthcare workers. For example, it can happen between a general practitioner and a medical oncologist while dealing with an emergency such as leukemia. It can be between a radiation oncologist and the primary healthcare worker. It can be between a surgeon and a medical oncologist. So it has a huge area where it can cover. Now the guidelines are between I have just in the interest of time just picked up the headings, like it is context, identification, mode of communication, consent form, type of consult, how to evaluate patient and what all you can manage, The guidelines cover the guideline is around 30 pages and it is divided into these 7 elements. We can use the drugs. We all know this by this time. There are list O, list A, list B, and the mode of consultation can be video, audio, and text. But when we apart from over-the-counter drugs, the other drugs such as add-on drugs for any medicine, chronic illness, or a refill of the drug, if someone has finished thyroid medicine and they want a prescription, that shall be mainly with the video consult, and just an audio or a text consult should be restricted only to over-the-counter drug. Never prescribe the narcotic drugs, and never do this mistake whatsoever, whether even if you have seen a patient 2, 3, 4 days prior. Please don't give a narcotic prescription by social media. Do's and don'ts of telemedicine. Patient identification is mandatory at all time. There is no exception to it. If a caregiver is taking a consult, you shall identify it. If it is a routine caregiver, it is okay. But if there is a new caregiver which has entered the picture and you can't identify him with your patient, then you have to take an undertaking from the patient that on the behalf of patient, he is taking the consult. Consent that is about the consenting and identification. You shall identify yourself as a brief intro, or you can just tell that I am a medical oncologist and so my name is. You have to maintain all the records of teleconsultation and save it on an iCloud or in an external hard drive. And if the prescription is being issued, which in most situations it will be, then please be sure that this prescription is applicable to all medical legal hassles, and it has to be as good as a regular prescription. Don'ts of telemedicine: patient's personal data and privacy confidentiality. All the rules apply same as of in-person consult. Do not deny emergency teleconsultation thinking that this is telemedicine, I will avoid or I will not do that, but limit it to immediate assistance, a first aid, referral advice, and very clearly mention that to bring the patient to the hospital as soon as possible. If your internet connection is improper, there are multiple breaks, you cannot see anything. Many times patient tells me, sir, I have a rash on the skin, or I have some a pustule, and they try to put your camera and then they do their best to show, and I refuse directly on the consult that for this you have to come, I can't see a clear picture and video will not help me. Do not breach patient privacy confidentiality. And to my mind, you can talk about chemotherapy such as paclitaxel, carboplatin, or anything, CHOP regimen, R-CHOP, but don't give exact doses and don't give the complete protocol like an in-person consult. All the codes of ethics do apply to telemedicine. This is the most important thing to remember. All rules regarding the ethics, privacy, data protection, counseling of patient, health education, correct diagnosis, and your prescription in that form. So everything what we think of in-person consult applies to the telemedicine also. And similarly, you shall be clear in your mind that all medical legal issues regarding telemedicine will be almost same as of in-person consult. This is the last slide, and it is a sample prescription. When you are issuing a prescription on telemedicine, be more specific because it is there in the record. It is you have to be very clear about all your details, registration, contact details, patient details, date, patient's complaint history. I mean, these are the parts of general, but in the general in-person consult, we can be a bit relaxed. But when you are talking about teleconsultation, be sure that all the instructions and everything are given in a proper way. So that's it. And thank you. Over to the organizers.
Thank you very much, Randeep. I think you had two lengthy topics and it was very difficult for you to cover everything, but even then brilliantly you have put the highlights. We now move on to Dr. Vineet Govinda Gupta, and he has another important topic, which is a follow-up from what Randeep has said, and that is precautions while sharing patient information with medical colleagues in social media, WhatsApp, email, Signal, etc. And Vineet will also be able to answer the chat question that Vamshi Krishna has put. So over to you, Vineet.
Thank you, sir. Good evening, everybody, and thank you, Purvish sir, for inviting me to this important meeting. Actually, this is important topic problem which we are dealing with every day. A lot of Western countries have very strict guideline for this. You might have heard of HIPAA guidelines, but work still need to be done here. So what I thought is I'll present a scenario which is quite common in oncology practice. So Mr. X is your patient who has metastatic lung cancer, and you do his NGS, and it throws up a rare mutation. So you decide to share the PDF report with your colleagues group and to get an opinion of how to treat the patient. They give you very good input to start the patient on targeted therapy. Next slide, please. So what happens actually is 3 weeks later, the patient disappears and your assistant calls the patient and it does not turn up. And 6 weeks later, your hospital informs you that patient has filed a formal complaint and he has made all the complaints to NMC and wants to go through legal system, that you have caused him monetary and reputation loss. So what has happened here actually? Next slide. So what happened actually is that in the large WhatsApp group where we posted, the thought that the case, one of our colleagues thought that the case was interesting, and he just put the first page on Twitter, which had the patient details. And one of the Twitter followers actually was known to the patient. And the news spread through Mr. X's business associate that this person has lung cancer, and his business was hit because it involved giving and lending money. And he also had social problems because many people thought it is a communicable disease. The next slide. So how to avoid these problems actually? So patient privacy is very important whenever we share any report, because patient shares many things with us which they would not share even with their own brother or their own close family member. And these are things which patient has a right to keep private. Also, knowledge of a patient poor health will definitely affect their business, their marital prospects, whether they can access insurance, and condition like cancer, STD, liver failure, addiction, etc. are very stigmatizing. So it is very important to maintain the patient privacy. So in the MCI, which is now NMC, the Code of Medical Ethics clearly state that with exception of when the information is released to protect another person or protect society, or when ordered by the court, it is the doctor who has to protect anything which has been revealed to the by the patient in confidence. So it is very important to maintain privacy of the patient. Next slide. So the problem with social media, which many people have mentioned earlier also, is that information spread very rapidly. The person you send it to is your intended recipient. He may not be the person who actually lands with it. And somebody can just add one commentary, blah, blah, on top of your. So the intent of the information can be changed. From a informative information exchange, it can become an emotional problem for you. And often anybody can share and add context to that information, and they don't have any accountability or responsibility, but you do, since you have a legal responsibility towards the information which is given to you. And the damage to your reputation can be profound and sometimes irreversible. So information, like many others have mentioned, any information you put on the internet will stay there forever. So it is good that you smarten up now rather than wait for things to become more tight. So some tips which I have been following and which I thought I can share with others. So I try to censor all potentially identifying information from any report or image. So it could be name, address, ID numbers, tumor block numbers, initial, gender, age, even dates, because they might help in identifying which patient is being. So if you have interacted with the American healthcare system, you would have experience with this kind of censoring. It can be done by software or just by simple cutting it out with a nice color marker. Next slide. For example, the same NGS report could have been shared in this format. You can see that all the confidential information is removed and there is no way to identify the patient, yet you can still get the same information. Next slide. So before sharing the report on a WhatsApp group, you should think twice. Would you be comfortable if this document spread beyond the intended circle? Will it lead to trouble for you? Would it matter if the same image gets posted on your personal profile, be it Facebook, Insta, Twitter? And if the patient is aware you are sharing this photo, are you sure he will not mind? So it is good idea to ask yourself these 3 questions before sharing any document. And one more thing which I have thought is that the fewer the number of recipients, instead of posting it in a group, it might be better to post it one-to-one, too few people, so that you have control over the recipients. And when you share something, they also bear that responsibility, and they hold, if you are sharing identifying information, they hold your reputation in their hands. So be careful when you're sharing to groups. And take consent if you're posting any identified information or images. always take consent from the patient. Next slide. So I just got 2 examples. So suppose I post to a doctor group that I have this patient, I write his name, he's so many years, he lives from Lucknow and he has lung cancer, what to do? So the right side is safer. You are, instead of sending to a group, you are sending to one person. You are removing identifiable information, and even he is smart and he asked for a censored NGS report. So this is a safer way to share the same information. Next slide. And this is just, so one of my patients posted one nice image which I thought would be uplifting to other patients. So I made sure to take her consent before posting it, and patient agreed. And I was able to post this image. Next slide. So it is still common, and actually because not much trouble has happened to anybody, we are still happily doing it. But breach of patient confidentiality is a serious matter. And mistake you are making today, it may be persecuted many years later when you have already forgotten about the mistake. So a few simple precautions can make the on-deal engagement safer. And definitely the laws are being tightened day by day, and they will be tighter in the future. So that's it. Thank you very much to everybody.
Thank you very much, Vineet. This is a increasingly challenging issue about how we are commonly using WhatsApp. Patients are using WhatsApp. We are having so many groups, but we don't know how much problem we can land up in the future. Thank you once more, Vineet. And we move over to Senior Medical Oncologist, Dr. Ghanashyam Biswas from Bhubaneswar. And his topic is how to interact on social media with the pharma representative. What are the do's and don'ts? Over to you, Ghanashyam.
So good evening all. So let me go to my topic, do's and don'ts while communicating with pharma representatives on the social media. So this is a group of mine. So maybe for last six years or so, this is a WhatsApp group of Healing Touch. So that constitutes me and my assistant and 132 oncology pharma colleagues. So that has helped while disseminating knowledge, so cautions, maybe conferences. So the today's triad, so we are talking about doctor, pharma and social media, the commonly used social media, so WhatsApp, Twitter or a Facebook, so like Pati, Patni or O. So the introduction is that, so the pharmaceutical firms are facing competitive regulatory pressures, and so they have a different types of promotions while looking at the physician's prescribing behavior. And so it is today more is spent on marketing rather than on research and development for many companies, not all. So over the years, so they have moved from a product oriented to a consumer oriented. Some bitter truths. So there is a lack of trust amongst physicians to many companies, or if we talk about the representatives who comes to your clinic. And according to one study, 75% don't trust the information provided by this. But the same doctors, they follow. So one of those, like 63% of the physicians get connected to Medscape for some knowledges. So what is the utility of pharmaceutical companies or a pharma representative and the social media? So to educate. So educate can be, we'll see the market or listen or connect with patients or connect with doctors. So one of the important can be a pharmacovigilance, clinical trial recruitment, digital communication and patient engagement through sophisticated use of social listening. And we have seen this in these COVID times. So coming to education, so disease specific information can be shared. And so this should be non-biased and we can better engage the healthcare providers. And again, so the COVID time has been a big example. Coming to market release, so they can share press releases of new drugs, devices, and social media can help the industry toot their own horn. So connection with patients, so we see a support groups of communities for rare diseases, and this is so common for oncology patients. And this can allow like-minded patients to connect and interact and discussing the benefits of a particular treatment or hospital or a experience with a particular oncologist. Coming to connection with the doctors, so it can be efficient means of education without the expense. A large number of physicians at one time can be put together, and opportunity to ask questions, so perhaps same fraternity with different representations. So coming to clinical trials, so I've been into active clinical trials. So now, so this can the biggest barrier for clinical trial, and that too again we have seen in the COVID time, is the enrollment. And according to one of the statistics, so 1/3 of the time for a PI or the whole trial team gets into the recruitment of the patient, and 40% of the sites, they cannot meet the enrollment targets. So, and the recent study showed that, and the social media, the pharma companies or the trial groups can very well improve their enrollments through a social media. So listening definitely is a good modality. So identify unmet needs, how to better innovate, and learn from the mistakes of your competitors, and assist in developing policies which can be a better tool for the future. Social media's tools available, so we have seen from Dr. Amish's slide, so I have just copied one slide. So it can be any social networks or professional networking, media sharing, content. So this is one of the slides on her keynote presentations. So without the permission, I have taken the slide. So the COVID pandemic, so in-person meeting has dropped from 78% to 15%. And if you have, even Purvish has also taken one of those surveys. So around 50% doesn't want to go and meet in this post-COVID world. Medical conferences attendance has dropped from 66% to 60%. Again, 50% doesn't want a physical conference. So meanwhile, remote sales meetings have really been benefited, which has jumped from 11 to 47%. So born out of COVID times, so at initial, the first wave, so we are confused. So is it a COVID pandemic or a webinar pandemic? And if you look at Google, so helping people think that they are doctors since 1998. So this is not a new. And this is one of the pictures. So you are working from home and work for home also. So the reality check with pharmaceuticals at times, so their expectations are something as a physician. So while sitting in front of the patient, so your expectations from a pharmaceutical company or a representation is different. So it is a double-edged sword, as you saw from Dr. Sumant Gupta's slide. So the benefits can be 4 P's. So promotion of organization, patient care, patient education, public health programs. And demerits can be of 5 P's: poor quality information, professional image damage, patient privacy breaches, personal and professional boundaries violation, and lastly, professional licensing and the legal issues for which, so PMP sir is always there for us. So the do's and don'ts of so in last summarizing my talk, so from the Google's eye, so for a do's, proper attire, proper language, scientific discussion, and ethical or moral values are so important, and support for patients and the legal aspects cannot be ignored. So lastly, don'ts are about other colleagues, about other institutes. So you cannot be big if you tell ill about your other colleagues and the other institutes. So misinformation, patient's privacy and confidentiality, and inappropriate photos and cost of a particular thing should not be on there. So thank you, ladies and gentlemen, for a patient hearing. So happy Diwali 2021 in advance. Thank you so much.
Thank you very much, Dada. Let's move on to the next speaker. And that is none other than Dr. Amish Vora, Senior Medical Oncologist and a live wire from New Delhi. His talk is moving across professional boundaries, getting socially involved with patients and relatives. Over to you, Amish.
Thank you, sir. Can I have my previous slide, please? Okay. When Parikh sir gave me this topic, I was literally laughing. And sir and many others know why. My topic is moving across professional boundaries, getting socially involved with patient or relative. Next slide, please. So there are a few case scenarios which come across, I think, every day to all of us. 30-year-old CA colon patient, post-surgery, post-chemo, 2 years follow-up, no recurrence. Invites for his marriage where there will be drinking, there will be some dancing. Question is, should we go with 2 years later if the patient relapses, recurs, and you know what will happen? Second scenario is 78-year-old female, CA ovary, your patient for 9 years, dies. Entire family knows you by this time. Children have become your friends. Diwali, Holi, we wish each other. You want to attend funeral. Should you go? And after patient has died, Can you continue her family as your friend and invite them for your social gatherings? Every day we get friend requests from patients on Facebook and LinkedIn. Should we accept them? And the last scenario which I was found thinking about it, if any of your close friend's father suffers from non-small cell lung cancer and you treat him, is your relation with your friend changes because you are now being his father's doctor? Next slide, please. This I have taken from the Facebook profile of Nick Van Dyke. He is a Los Angeles entertainment executive. He was being treated for multiple myeloma by Dr. Bart Barloghi. Dr. Bart is a legend in myeloma, we all know. And according to this article, Dr. Bart Barloghi used to invite many of his patients to dinner at his own cost, where the patient's family, and he always used to say that these people are coming from far away distance and it helps them, overcome their grief. Next slide, please. What do Indian guidelines or ethics say? National Medical Commission guidelines amended up to 8th of October 2016. Next slide. Has only one paragraph, that is a second adultery or improper conduct. Nothing beyond this, nothing detailing. So, this is a gray zone. Next slide, please. Some guidelines do exist. In 2019, Indian Psychiatric Society, along with Bangalore Declaration Group, that is a team of doctors across specialties, they have come out with a guidelines which emphasizes on sexual relationship. Next slide, please. And MCI in 1990 adopted these guidelines, and they say that no doctor can ever enter into any of the sexual, whether consensual or non-consensual, and with current patients or former patients also. But isn't this obvious? But we would laugh at in UK in 2013. Next slide, please. Allowed doctors to date former patients, and this was 2013 amended guidelines. They said that if patient has become your former patient and there is a no longer patient-doctor relationship, you can date such patients. Next slide, please. Can we accept Facebook requests from patients? GMC, HIPAA, AHA, Canadian guidelines, means UK, American, Canadian, and Australian guidelines. They advise against the same. There is no law exists in India, according to my verbal talk with 3 lawyers, and maybe Parikh sir can correct me in the panel. Next slide, please. But this is going to change, because if you see the last year, American College of Obstetrician and Gynecologists, they said we are not going to suggest our members whether they should become Facebook friends or not. It is for the physicians to decide. We are not telling them what to do. Next slide, please. Can we attend parties, weddings, funerals of patients and relatives? There is no law which prohibits the same, according to my understanding. Is it unethical? Now, this is extremely important. The lawyers, they keep telling me that ethics always remains above the law. The law will tell you what to do, what not to do. Ethics is up to you. You need to decide what is right or wrong. If you think it is right to go to a funeral of a patient without crossing your boundaries, so be it. That is what my understanding is. Next slide, please. Last question, can we treat our family and friends? American Medical Association and American College of Physicians strongly advises against it. Canadian guidelines advises against it. UK guidelines strictly has very strong laws that only in case of emergencies you should treat them, otherwise no. In India, I am not aware of any such law. We all treat our friends and family members. Next slide, please. There are many such gray areas, and this is my last slide, and I'll give over the platform to Parikh sir to discuss. There are so many such areas where there are no guidelines exist. Should physicians engage into business transaction with patients? Should physicians hire patients or their relatives in their organization? Can physician marry someone from the patient's family? I don't think there are any answers to this. And with these burning questions, I would like Parikh sir to discuss these in his panel. Thank you very much, sir, for giving me this opportunity. Over to you, sir.
As usual, nice job. Thank you very much, Amish. And like you said, the ball is now in my court. I have to discuss several of these points on the panel, and I'm delighted to have some very important names as my panelists. Dr. S.P. Somashekar, Senior Surgical Oncologist, Dr. Rajiv Vijay Kumar, Medical Oncologist, Dr. Indu Bansal, Radiation Oncologist, Dr. Manoj Mahajan, Medical Oncologist, Dr. Vamsi Krishna, Medical Oncologist, and Dr. Anil Singh, Hemato-Oncologist. So we have a lot to ask, and I'm sure that the panelists will be able to help us. So I'm starting with this example. And the title of this message on social media was, why can't we be friends? So just as Amish was asking. And this is a case-based analysis of ethical issues with social media in health. And I'm not sure you can see this, but it shows that it has been retweeted 80 times by 65 users. And it is now accessible to more than 10 million followers. So 80 times 65 users and potentially 10 million followers is what will happen with a single comment that you have put on social media. Next slide. I'm sure everybody in India and South Asia will recognize these two. On the left, we have Shah Rukh Khan, and on the right, we have Chunky Pandey. So why am I showing this? I'm showing this because on social media next, we have their sibling, their son and daughter who are in the limelight just now. So son of Shah Rukh Khan and daughter of Chunky Pandey. And why are they on the limelight? Next slide. Because there was a social media WhatsApp post exchange between Ananya Pandey and Aryan Khan. And as a result of that, Ananya Pandey had to go to the police, to go to the Narcotics Bureau. And this is what she has said. I deny supplying drugs to Aryan Khan. I have never consumed drugs in my life. Social media chat about arranging ganja was meant as a joke. And I'm sure that whoever is following the subsequent comments in the newspapers and social media know what is really going on. I'm not able to move to the next slide. But this is, some people were asking a question on, can social media comments be deleted, or can we ask them to delete it? So now look at how the hand or the mind behind the owners or the operating people on the social media are behaving. And they are behaving like an ass. Twitter, for instance, has refused to ban Taliban accounts. It says we will remain vigilant and moderate their content. On the other hand, Twitter has suspended a GOP lawmaker Jim Banks' official account only because he wrote Mr. instead of Mrs. for a 4-star officer. Now, I'm sure that you know how ridiculous social media policing can take place. So now I'm going to ask all the panelists to give their opinion. Let us move beyond Aryan Khan's case and see what is the legal implications of social media, WhatsApp. So is WhatsApp chat admissible as evidence in court? Is it yes or no? Can I start with Rajiv Vijay Kumar?
Good evening, sir. Sir, I think that with due course of time, with so much of privacy, your chats are private and other stuff, it's like end-to-end coding. This is definitely going to be taken as, it's like a written document. It's almost like as though I'm writing a prescription, because we use WhatsApp for prescriptions also. Right. Although it's like we have queries, should we or not, this will be taken as evidence in due course of time, if not now.
Okay. What about Anil Singh? What is your opinion?
I think they would be admissible because it's just like a recorded conversation.
Yeah.
If recorded conversation is admissible, then it's also be admissible.
Hindu, what is your opinion?
Sir, I think it is admissible as evidence in court because I'm aware of a doctor, a friend of mine, whose WhatsApp chat was taken to the court and she had to face some charges.
Right.
I think it is admissible.
Okay. Dr. Somashekar, what is your opinion?
Sir, absolutely yes, because Supreme Court, High Court has mandated a notice served to anybody on WhatsApp is equivalent to a notice delivered by court through a police. So right. WhatsApp, this one is there, and I already know that a doctor who posted something about patient through a WhatsApp conversation was actually accepted as evidence in Bangalore High Court.
Okay. Manoj Mahajan, what is your thoughts on this?
Yes, sir. I think earlier Gmail was not an evidence, but nowadays Gmail tracking and everything is evidence. So probably, if not now, in due course of time, it will definitely be considered as evidence in a court.
And Dr. Vamsi Krishna, what do you think?
Same, sir. I don't think we should take WhatsApp very lightly. They can be going to court. Even like Rajiv says, maybe not today, but definitely in the very near future, it is going to be admissible.
So I was also thinking on the same lines as all of you, but I was really surprised to find that it is not so in all instances. Now let me go to the next slide. Why am I not being able to?
Sir, because my screen is shared, so would you like to share your screen?
Okay, no, you continue. Go to the next slide, please. So this is a Supreme Court bench justice decision, and this included the Chief Justice of India as well. Their statement is, what is the evidential value of WhatsApp messages these days? Anything can be created and deleted on social media. We don't attach any value to WhatsApp message. Isn't it ridiculous? Next slide. They also said in July 2021 that messages exchanged on social media platforms have no evidential value. But there was an asterisk on this, that is, conditions apply. And here it was because authors of such WhatsApp messages could not be tied to them in business partnerships governed by agreements. So if I'm an official on behalf of the government, if somebody else is an official on behalf of the company, we have signed a document. We have signed on a stamp paper an agreement. Now that agreement's terms cannot be changed just because of a WhatsApp message by my assistant to somebody else's assistant. So that was the reason why the court had mentioned that. Next slide. But on the other hand, as all of you have mentioned, there under the Indian Evidence Act, section 62 and 63, the primary evidence is original and the secondary evidence is certified copy. Under the Information Technology Act, section 2, it defines electronic records. And electronic records is admissible as evidence in court as per laws. And this could be data, record, images, sound stored, received, or sent in any electronic form. Next slide. So WhatsApp messages may be acceptable by the court as secondary evidence. Okay, now we have to distinguish between primary and secondary evidence. The only instance, as SP Somasekhar already mentioned, that it is a primary evidence is when a summons or a notice from the court is issued or under telemedicine practice guidelines. Next slide. Now I have to show you my screen. Can I share my screen, please? Unfortunately, I have to change because there's a video which is not playing. And I would like all of you to very clearly pay attention to what is happening in this video.
Sir, sorry to interrupt you, sir. It's not audible.
Oh, sorry.
Yes, sir, not audible. Yeah.
Okay, okay.
Can I request you to share with screen sound, with sound, sorry.
Okay, instead of wasting time, let me just summarize what is happening. Here there is a doctor. He is standing with a team of colleagues around a patient who's obviously on a ventilator or assisted respiration. And he's saying that this is a patient who came to us in an unconscious state, and then we were at a loss what to do with him. We came down to a differential diagnosis. We did these 3 tests. These are the results of these tests, and ultimately we found that he is suffering from paracetamol poisoning, which is not a common in the rural areas. And then he is saying that, asking the patient, how are you? And the patient is responding that he is much better. And finally, he is asking his colleagues, how do they feel about the difficult diagnosis and how he, as a senior person in charge of the patient, was able to, resolve this issue. So now I am going to ask the panelists, if this was on social media, okay, it must have been circulated 1,000 times, because now when I wanted to forward it, I could only forward to one person at a time. So Vamshi, you are smiling, so let me ask you, what are the first thoughts that come to your mind when you see such a video on social media?
It's pretty unprofessional, sir, to talk in front of a conscious patient like this and discuss the case with with anybody else. I would say it's pretty unprofessional.
All right.
I'm not sure the ethical of the legal issue, but it's definitely unprofessional.
All right. Dr. Somashekar.
Sir, as Vamsi told, there are 3-4 issues: patient factor, you as a doctor, and the other colleagues with you. Number one, you actually let down the whole other team, differentiating. There could be 2 different types of clinical, breaching the privacy of the patient, and then the way you analyzed without a proper review board with the peers. So it's inappropriate, unethical, breaching of privacy, and also letting down the other people, telling that they missed the diagnosis and putting suspicion on your community, don't understanding what access those people had of history and technology or the time to arrive at. In all 4 counts, it's like wrong.
All right. Manoj, what do you think?
Sir, the most important, breach of privacy. Probably that is not acceptable. The same case could have been discussed without a patient giving the virtual scenario or actual scenario with hiding all the identity.
Right. So everybody seems to say that it is breach of privacy. Okay, Indu, what if there was a documented consent from the patient to be allowed to express this as well as show him on the video? Would that change anything?
So definitely, I think in the unconscious patient, you cannot take a consent from the patient for posting anything on the media or anywhere. So ideally, without taking any consent, we cannot discuss any information of the patient, even with the relatives. So there has to be an informed consent from the patient, and this video is being circulated without even the eyes of the client confidentiality, the client privacy. Everything is being disturbed here, as well as it is also hampering the dual relationship between the patient and the doctor.
Right.
And as Dr. Vamsi said, that it's also breaching the competence level of the colleagues.
Right.
So this should not have been posted.
Correct. Rajiv, any other comments?
So the basic thing is that actually gone are the days. We generally don't actually discuss anything in front of the patient anymore. We actually come, sit, we see the patient, then come outside, and then afterwards then discuss. So in front of the patient, it's only like, hello, how are you doing? I hope you're doing well. I'm sure you're doing well. That's it. So this is something like actually a very abstract situation for me, where we don't actually sit, congregate around the patient and then discuss about the patient at all. That's completely out of sync for this present generation.
Got it. And final word from Anil.
Yeah, apart from the confidentiality issues, I think this seems to be a blatant case of advertising his own prowess.
Right.
It is unethical completely.
Okay, got it. So now let's look at some things that have happened in Indian courts and Indian doctors. Okay, this was something that happened in Kerala. A lady gave birth to triplets, and the doctors who were there, the gynecologists, the anesthetists, they took photographs of the C-section and shared them on WhatsApp. And finally, these doctors were they're facing a criminal case under section 354 of IPC. So any of the panelists think that this is a wrong thing, or they agree that such criminal charges should be put against these doctors?
So what was the intent of taking it and sharing it on WhatsApp?
The intent is of no consequence. Intent doesn't matter as far as law is concerned.
So then, without consent, it's completely inappropriate for the doctor to have shared it on WhatsApp.
Right, right. So you agree that these doctors should pay us a criminal charge?
I don't know whether criminal, but it was inappropriate for them to have done it. That's a very difficult line to cross.
Okay, Somashekar, what do you think?
Sir, there are two most important issues. Number one, forget the patient gave a consent and you did it is wrong. Second, we are bound by code of ethics that if we want to discuss it is an our scientific problem in a right way. Now, yes. WhatsApp, if you know it's going to go on a WhatsApp, content wrong is different. The audience to which it goes. If you see in YouTube, you may be right, but they say at the time, is this content for open public, medical professional, age? And you are supposed to do. Now, a content inappropriate to general public is going to harm the public, and privacy of patient totally breached, and there is no, and this is not the forum a doctor should go. Totally, it's wrong on both the point. Putting to the people who are not ready to receive it, and then putting of somebody's privacy, which is totally wrong with their consent, may not be criminal, but there should be appropriate within the act of the doctor framework to take such actions.
Got it. Got it. Now let's move to this. This is from Singapore. Okay. And Dr. Chiang, director of the neuroscience clinic at the National University Hospital, was fined $50,000 for breach of medical confidentiality. And what did he do? He gave the information about the patient's conditions to the woman's husband, who was posing as the woman's, to the woman's brother, who was posing as a husband on the phone. So doctor was tricked. Hindu, has something like this ever happened to you, that you were tricked into giving information to somebody on the phone without knowing who is on the other side?
Sir, normally patients call and we always ask, who are you? How are you related to the patient? But on the phone, we don't know whether the person who is talking to us is actually the relative or not.
Right.
So it becomes very tough, and it happens quite often. So I just tell them it would be better that if you come and discuss it with me in person.
Right, right.
Yeah.
Anil, what is your opinion about this case?
Yeah, certainly. We also get a lot of phone calls with people, and people in India have kind of think, hey, let me talk to the doctor. Let me talk. There's some kind of importance they try to derive from that.
Yes.
So we always tell them who you are, and if they tell I'm uncle or I'm so and so, I still say you have to come to the clinic with the patient's relatives, and then we can talk. I am not going to discuss at all.
Excellent, excellent.
Sir, I just want to add in this.
Please go ahead. Go ahead.
I had 3 specific incidents. Number one, my patients taught us. We know that we don't do that. In India, it's a different thing where patients, all the family, husband, wife, children, mother-in-law, hide from the patient until you discuss with us as a conduit. We know that other than consent of the person, neither husband, mother, father is valid. I had 3 instances. Patient was identified as BRCA. She told me very clearly, this should not be told to my sister, mother, anybody. And you don't have consent. Patient voluntarily told this, they will call you and ask you to discriminate me. Number 2, there was a seropositive, and the patient wife told me, don't tell my husband, he will think that it is because of my marriage will go, and you don't have my consent. So another was a cancer, and that was to be used by the family mother-in-law and other thing for a conflict in the family against the patient. Patients told voluntarily, you have no consent, you cannot discuss with me. Anybody want to do, you should say, I have discussed with the patient. You say you are a close relative, go and ask them directly, so they will disclose to you, not me.
So about the first and third case, there is no law that I can contradict. But as far as the HIV seropositivity is concerned, law says that it must be disclosed to the spouse of the patient. So even if the one spouse says, I don't want you to tell my husband or wife, it is our legal duty we must show it to them or tell them.
So what about hepatitis?
Hepatitis, the law is not clear, but definitely for HIV, it is very clear. So now all of us have also seen on social media people who are pretending to be doctors or advertising themselves as the world's best and so on and so forth. So Vamshi, when a patient comes to you saying that I have heard this doctor is doing such good activities, why don't you refer me to him? Because I think my case might benefit. How will you react to that?
So what I generally tell, sir, is that there is no evidence in publication about this. I personally am not aware of the data which they are claiming, and I am not supporting it. The rest is up to you. I do not say anything more than that.
Correct. Manoj Mahajan, what is your opinion?
Yes, sir. Similar to Dr. Vamshi, I usually decline. I say ki any of the medical oncologists will not advise you for the therapy which has been advertised. I don't know about the person or the such clinic, and like few of my patients has again had gone and had a very bad experience. I usually share, if the patient agrees with that, you can share your concerns with the other patient.
Right, right. So we have we put it at arm's length. We do not give any written referral note, and let the patient or relatives do what they want to do. Is that right?
Yes.
Okay, great.
So, but just a question, maybe I'm being a bit nitpicking on this, but I won't even say that my other patient went and had a bad experience. Those things I would not share at all.
Right,
But that
right.
itself is showing your bias in it. So best is to be unbiased and just leave it to the patient.
Right.
Just my
Sir,
thought.
I normally say I don't have expertise in this therapy, so I'm not the best person to comment on this.
Excellent. I think that we should do for other pathies also, like Ayurveda or homeopathy as well. Now, this is a very interesting case from Boston Medical Center. And one doctor was fined $5,000 by the court. And what is the purpose? Because he was engaged in conduct that undermines the public confidence regarding the integrity of the medical profession. And what had happened, that poor fellow was on an emergency duty shift. And when he had his break to have food, he fell asleep because he was exhausted. So we should be ready to face such ridiculous charges against us, and as if we are not human beings, and we are supposed to work like super robots without any concern about our health. In fact, if you know, the Hippocrates Oath has been reworded by the World Medical Federation to say that it is our duty to look after our own health while we look after the patient. And I think the other stakeholders, especially the judiciary, should be well aware of this. Now, this is something that we have already discussed, but I would also like to share some things of how the information or misinformation may spread on social media, and then the consequence of the comments that happen on social media. So this is about a doctor who posted patients' pictures on social media. A right to information activist has complained. Okay, patient has not complained, patient's relatives have not complained, but RTI activists complained about the patient's photo on Facebook. And the Maharashtra Medical Council then sent a notice to the plastic surgeon for explanation. The doctor responded that a patient with diabetes and so much burns never survives. And my job was to bring awareness about burns treatment, and it was done after obtaining the patient's consent. What is your opinion about this? Anil, let me start with you.
I would tend to think that if this was done in the right spirit and if he had really a written consent from the patient, it should be okay.
Right. Indu?
Sir, if the patient has given consent, I think it is okay, but not without patient's consent.
Yeah.
So provided that the patient's
patient consent is there.
Not consent, sir. Whether while sharing the patient's face was hidden, the details were not given. If that was done, then probably. But if the pic was completely shared, then I don't think that's very right.
So if the patient has given consent, there is no harm in sharing the full pic where the patient can be identified. Somashekar, what do you think?
Sir, I exactly know this case. I was one of an expert called by Karnataka Medical Council. It happened in my hospital and another big cardiac center. This exactly was done, and the way they did, beautiful consent was first done, everything written, patient video consent was recorded. It didn't stand water in medical council, because there is a very thin line between self-propagation marketing and patient education. And the Karnataka Medical Council told clearly our institution and other neighbor institution, if it is for educative purpose, as per lot of acts, the institute should step in and do it under the name of institution without bringing the doctor's name. If a doctor is doing for himself and education, then it looks more like personal promotion and not education, and this was overruled. After that, in my institution, the director office passed a law, all any patient related thing has to go through a board, institute will do it and not an individual doctor.
Yeah, but that is not what the law says. The law says that as long as you have consent, even in the individual doctor is allowed to do that. Anyway, what I want to focus on is what happened on the social media after this happened. And look at the comments that are posted by the lay public. And I'm very happy to see this comment. So this is one comment that says, I don't understand why you people are publishing that as a news. You already mentioned that the said doctor has taken permission of the patient before posting. So rather you should compliment the doctors for curing the patient with severe burns. Another comment is much that ado about nothing. And the third one is actually now going against the RTI activists, saying that they are doing this for blackmail business. So they're like everybody was saying, and Sumant rightly pointed out, social media is double-edged sword. And in this instance, the social media is actually on the side of the doctor. Now let's take this photograph, okay? And I hope that you don't recognize the doctor. I've tried to make sure that you don't. But if you do, then my apology. Now we have talked about relative patient and doctor's photographs. What about if the photograph also contains a relative? Is the patient's consent enough, or we need a consent from the relative as well? Manoj, what do you think?
Sir, for audio-visual or like I think patient's relatives' consent should be required.
Right. Anil, what do you think?
Sometimes it is either the parent or the spouse of the patient, and they are sitting together and talking to you.
Yes.
And in that case, if the patient consent is given, it is implied that the spouse or the parent or the child is also.
Right. Okay. Vamshi, what do you think?
Sir, posting anybody's photo on video, you need their consent, whether it be relative or patient.
Excellent. So I will stop there because that is exactly what should be done. Any person in the photograph, we need to have consent, individual consent from that particular person. Now, this is another thing which is on WhatsApp, and it has been recently shared by somebody, in fact, this morning. So I would like your opinion, and I will go through each and every panel members. So a person has sent a powder to the government lab for evaluation. And this is a jackfruit powder, and it is commercially manufactured and marketed. And the report from the government lab, tested in the government lab, says that this powder is laced with metformin. Now, if a patient comes to you, now you have seen this on today's WhatsApp. In the evening in your clinic, a patient comes to you and says that, doctor, I have had a miracle. My diabetes is controlled because I'm taking this jackfruit powder from this particular manufacturer. What would be your reaction? How will you discuss with the patient? Somashekar, can I start with you?
Absolutely, sir. The current way to prescribe is evidence-based medicine, and this we know is evidence level 10. So we say that yes, it could be, it may not be, but that is not an evidence-based medicine proved by use across and tested and tied into across all the recommendations into society. So until that is done, it is maybe right. It's not my subject, but it is not evidence-based medicine for me enough to prescribe today.
Right. Rajiv Vijay Kumar, what will you say?
Sir, I would just say that this is an option that you have, but definitely I would not recommend this because we don't know what is going to happen. I would want you to stick to the standard guidelines, whatever therapies that we've been giving. There are certain drugs which would have, there's certain flaws which may have a benefit in diabetes, but right now we don't have enough evidence. I would like you to stick with what I prescribe.
All right. Indu, would you say that I am an oncologist? I don't know anything about treating diabetes as much as an endocrinologist is there. You please go and refer to.
Definitely, sir. Definitely, sir.
So that is
because this patient can land up in hypoglycemia also.
Right.
I mean, we don't know what is the quantity of metformin, and I'm not an expert in that.
Right. Manoj Mahajan, what do you think?
So definitely, I would say stay away from whatever the alternative therapies because I'm not the expert in those therapies.
Vamshi, do you face similar things of patients
Yes, sir,
taking alternate medicine?
So half of our patients are on papaya seeds and they're happy about it. So,
Right.
that's common. So I just tell them, look, I am not aware of it, if it works or not. It is really your call. I wouldn't recommend it, nor would I say against it. It's your
Right,
decision.
right. Anil, you might have a different opinion about home remedies or natural remedies. What would you do in such a circumstance?
Yeah, there are two issues here. One is that suppose you are treating a patient with thrombocytopenia and you're giving him the proper treatment, and he also goes and takes papaya or papaya seeds or whatever. And then either if the patient gets well, he will give credit to the papaya seeds, right? And then it is likely that he may skip some of your drugs. So
Yes.
he may not follow your drugs. So I tell them very strictly, see, if you want to take papaya, go and take papaya. I will not give you any treatment. But when I give you a treatment, I don't want you to take anything else which is not proven.
All right. But
Sir, I
I'm
think
sure
the
that you
simple,
understand.
I think the simple answer is we are governed by allopathy, so medical council. Ayurveda has homeopathy. We are not studied. We have no degree qualification. The right answer is I am not trained, qualified, or certified in that. So I'm as ignorant or this one as you. So I'm not the right person to advise for or against.
All right. Okay. Let's close this and move to the next point. Now let's look at a currently active patient. And now I'm going to try and answer the question that Amish was asking in his last slide. So there's a female doctor who has a personal Facebook page, and there's a male patient under her treatment who sends a friend's request to the doctor. Now what should the doctor do? Does this request blur a patient-physician boundary? And should the doctor accept or decline this request? Let me start with Manoj Mahajan.
Sir, frankly speaking, I'm not sure.
Okay, fine. That's good. Indu, what would you do?
Sir, I normally don't accept patients' requests.
Right, right. Somashekar,
Sir,
you are a
I
charismatic
know
doctor.
there
Everybody
is a
wants to be your friend.
Sir, I know there is a specific law in US, number one, that can a patient and a doctor after a certain time can have any personal, this one beyond this. If you are currently actively treating that patient in any form, you are not allowed to have anything other than patient-doctor relation. And the embargo in a specialty, like for example, this quite often happens in psychology, psychiatry. And in US, there is a law which says there is an embargo of 2 years. And beyond that, if you're actively not treating, handed over to somebody else, you can also have a personal friend relation. So it is inappropriate to accept it by law if you're treating them and there is an embargo of a duration, which unfortunately in India, the law is not there, but they can be extrapolated from other countries.
Rajiv Vijay Kumar.
Sir, generally this is unacceptable for an active patient, but for a patient but if you've been very close to them during your active treatment, no. Probably after they have completed therapy, then afterwards they become good friends and they propagate your name. Then afterwards, then you can probably think of doing that. Probably you can accept if you actually are happy with them.
So Rajiv, you are sitting on the fence a little bit. Okay.
I know.
Now this is from one of our colleagues, patient with lung cancer and multiple bone metastasis, whom I saw yesterday, put in a message today that he slept well first time in the last 2 months. And this was the message. My pleasure to inform you that last night I had a good sleep from 9 p.m. to 3 a.m. after 2 months. The degree of food intake was slightly enhanced. I am deeply touched by your commitment and passion. If I, as a doctor, receive such a message from the patient, my chest swells up. I feel very satisfied. And in my pleasure, I share it on Facebook with you colleagues. Am I doing the right thing or the wrong thing? Vamsi,
completely dangerous.
I would say it's wrong.
Okay.
It's wrong.
Anil Singhvi?
It's wrong.
Okay. So everybody says it's wrong. Now let's talk about former patient, and Somashekar has already mentioned this. So here is patient who has not only completed 2 years, but completed treatment under the specialist 8 years ago. 5 years ago, the specialist handed over the patient back to the GP or family. Now the ex-patient sends a friend's request on Facebook. And Somashekar has said that under US laws, this is acceptable. Indu, what do you think?
Sir, I was not aware of this law. So
That is in USA. There is no law in India. In India, there is absolutely no law.
So not sure.
Not sure. Okay. Vamsi, what would you do?
I am not on Facebook, sir, so I really don't get this problem.
Sir,
I am
ideally,
off Facebook for last 4 years.
sir, I think ideally
Right.
there should be two accounts, one a personal account and a professional account. In professional account, maybe we can add them, but not on the personal account.
Okay, great. Let's move on. So if you want to decline, then a way of sending a polite message is I cannot accept because I follow a policy of not connecting with patients through social media. Now, social media friend is there. He has been there since the last 2 years, and now he's recently diagnosed with cancer. You know him well, and he is under your treatment. You have started neoadjuvant chemotherapy 1 week ago. On Facebook, this Facebook friend says, what should I do because I'm having chemotherapy induced vomit? Rajiv, what would you do?
Sir, I would put a polite message that kindly discuss this in person or call up or DM me. I would not appreciate you doing this on social media or on Facebook.
Right. Manoj Mahajan, how do you deal with this?
Yes, sir. It is like politely we should decline all these
Right.
patient-related things to or like clinical things to in person and decline rest of the things.
Vamshi, you are not on Facebook, so I can't ask you. I will move to Anil Singhvi. Anil, what will you do?
Absolutely no.
No. Okay. Now, what are your thoughts? And I would ask everybody, I'll start with Somashekar. In order to maintain confidentiality, I would prefer not to discuss this on Facebook. Everybody has said this, right? Your side effects need to be documented in your medical records. Why don't you contact my office to schedule a visit? This requires a proper telemedicine consultation. Shall we switch to a WhatsApp call at a mutually convenient time? You need to be examined to check for other side effects. Please come to the emergency ward of the hospital immediately. So, Somashekar, which of these four would be your first choice in such a situation?
Sir, I have a ready message because in Bangalore every day I face this. I have a ready message. I have a ready message typed. Number one, I'll tell social media is not for any professional consultation. It's for socialization.
Right.
So I have a ready-made thing that if it is emergency, there is a name and place to report. And if it is not, our department has an official number and call. And I just see that this cannot be ignored. Please report it immediately. This
Right.
where our team takes care. I have a ready message, photo, number, place. Because as per the law, in case of emergency, you cannot deny an advice at that moment in whatever platform patient agreed, but it didn't have to be an advice. You have to guide the person. So I say emergency, immediately come to casualty. This is the number my team takes it. In case of this number, this is the official duty mobile of the department for this to contact.
So
And after that, I say this is the way it can be going in future.
You have decided on an auto reply mode, right?
Sir, I face it every day, so I just immediately send it back.
Agreed. It's a good idea. Rajiv, what do you think?
Sir,
would you
the same
choose
thing,
one of these four options?
Sir, I would go to the first option, sir. In sense that not first option, your side effects need to be documented. Why don't you contact my office to schedule a visit?
Right. Indu, what will you do?
Sir, I always tell them that it's. I would be happy with the fourth option, that you need to be examined to check for other side effects.
Right.
Better to come to the emergency.
Manoj?
So I think although any one of the four options are
all are good. Vamshi, which is your preferred?
So I would put it as one and just put it privately message him separately or one of the other things. I don't think the last thing we should tell on Facebook as well, because then the patient is being told publicly, come to emergency. That's also not correct.
Okay.
And that's my feeling.
Right. I think that's good option. Anil, what will you do?
I just say, please call me or come to my office.
Right. Perfect. Now, patient, but not in your practice. Okay. Person is following you on professional Twitter handle, which is a public handle that you're using for the last 6 months. She sends a message that she is found to have BRCA mutation and is worried about breast cancer. She is asking what screening test should she undergo. Anil, what will you do?
The same thing. We refuse to give any advice on.
Okay. Vamshi, what will you do?
Same thing, sir. Ask her to either come meet me personally or else meet the counselor or personal.
Anybody on the panel disagrees that asking, don't answer anything specific, just ask them to come and visit you personally, right?
Correct.
Okay. Now, patient asks for second opinion on social media. Unknown person sends WhatsApp message, introduces himself, shares biopsy report, details of ongoing therapy. He says, I'm not sure that the treatment is right and I want your second opinion. What will you do? Somashekar, let's start with you.
Sir, absolutely no. Especially now in India, we have been defined what is a proper telemedicine. This one that starts by number one, identifying the proof and identity of the person. It is very well defined that it is not a coax. It is not wrong. Identifying. Second, consent from the patient, understanding limitation of telemedicine. Number four, documenting from the health organization. I am abiding by the rules. So in all counts, it is not acceptable. This is not a telemedicine. Official telemedicine is a different way which needs to be done.
All right, Rajiv.
Sir, we would say tell the patient that you can either use one of our, we'll give them details of a telemedicine consult and say, please book an appointment online, pay the consultation fee, share your documents through that particular app, and then see me. So therefore, it becomes an official entity.
Hindu, what did you do?
Sir, official teleconsultation.
Got it. Got it.
And on that, we definitely write it's a video consultation or a telephonic consultation.
Okay. So now your patient is coming back to you with a second opinion from a colleague. Patient was recommended neoadjuvant chemotherapy followed by breast conservative surgery. Returns and shows you a WhatsApp message from a senior colleague. And the message says, in your case, it is best treatment is MRM without wasting time. Patients want you to discuss on WhatsApp group with you, the patient and your senior colleague. What will you do? Vamshi?
I would refuse. I would say this is my opinion. And if I respect my senior colleague, you are free to decide whichever you want to follow.
All right. Anil, what will you do?
Same thing. I can just tell him that I'm not going to discuss with anybody.
Manoj Mahajan?
If the senior colleague wants, they can call us.
Yeah, we should not discourage in this way. Straight away say no. Come to the clinic and meet in person, and whatever the other opinion is, that is respectable. This is my opinion, I can say.
Okay, good. Excellent. So there is a new term that is called medutainment, and that is medicine, education, and entertainment. And actually, in some ways, it actually helps learning because it takes away the boredom of what we are doing, like we are doing today. But while we are doing that, there are certain precautions that need to be taken. And as Somashekar and somebody else also had mentioned, on social media, we do not know what is the age or the appropriateness for the audience who is receiving the information. So if you look at point number 3 and 4, on Snapchat, 25% of the users are teenagers. And on Instagram, almost more than half, the 50% users are between the age of 18 and 25 years. So what we might present in a medical conference for our colleagues may not be appropriate for teens and youngsters as well. So I am sure that all of you agree. If somebody doesn't agree, please let me know.
Sir, you're absolutely right. I will tell you that, in YouTube, we used to have surgical videos done, and in an era when it was not done, and the people at the time of uploading who doesn't specify, following people inappropriate to watch, you get censored and your social media account can be stopped for some time. Right. Twitter has started something new. If you post any photo, one caption come before uploading. Please let us know who are all seen in this photo. Can you identify? Right. Even though they have not stopped us stopping, it is sort of, absolutely inappropriate because content may be right, consent may be right, everything. It is in a forum which is not controlled, and that itself may be wrong. That, a wrong thing was given to a wrong person, and because of that, we got edited. So it's very important to understand that this is not a predefined area like Medscape or, somewhere where you share it. This is the common public. You are liable for sharing a right content to the wrong audience.
Right. So I think this is what is very important, what Somashekar said, and all of us should keep that in mind. So truly, when we talk about social media and doctors and what are the boundaries, it is like the coronavirus, which is more still an enigma, like the Enigma machine that Germany was using in World War II. So with that, I thank the panelists for a wonderful interactive discussion and all their insightful comments. Now it is time for the take-home message, and for that I will stop sharing, and I will ask Dr. Bharat, if you are still around, over to you.
Yes, sir. the photo which you have used is 3 years old, so I'm looking a little young in that. So thank you very much for creating this opportunity of learning and sharing everybody's thought. And Dr. Brown is probably not there. For take-home message, I'll share a few of what she has covered, which I learned from about the social media. Social media is a little different from normal media because it is active. So I always thought social media just posted something, but it is active where everybody is a creative producer as well as managers. And what we don't learn about is the controlling the pace, how to absorb it. The pragmatic advices what other patients can give to each other are often more than what we can give as a patient, as a physician. It does empower the patient to a certain extent. However, it gives ethical issues like privacy, boundary, the equity, and the misinformation along with the positive sides. And
Did we lose him? Is he still there or he's gone? Okay, I think we have lost him. Can we move to the next part of the agenda, please?
Sure, sir.
Thank you.
So, good evening, sir. This is Vishwa here. I think the is not able to connect. So, myself, Vishwa Mishra, and I'm heading marketing. And I thank everyone here, all the speakers, panelists, and faculty members for that healthy and fruitful discussion. We all know that pandemic has taken and diminished the digital boundaries and increased both the convenience and at the same time the complexities of the interaction. But nevertheless, the wonderful interaction has, I believe, has helped us to understand how to go ahead. And special thanks to Purvish sir for making this concept into reality and conducting this wonderful talk session, sir. Thank you,
sir.
Sir.
Before we part, I want to ask one question from my side.
Please.
Many of the social media platforms is like WhatsApp or Telegram gives an option of deletion. So disappearing messages after 7 days or disappear the photo after one view. So, if we share a report and it is deleted after a recipient has seen it once. So where to place that particular type of, does it give some sense of security?
Understood. But in that 1 second of observation, if the person takes a screenshot and then shares with others, we are still in soup. So
but sir, isn't it the fault of that person who is committing this?
But proving that it is not my fault in a court of law will be extremely difficult. So please let us not get carried away and feel that we are secure because we have a disappearing message system set up in our WhatsApp. Don't think that we are safe because of that.
Okay. Sorry, I think my network dropped.
Yeah. But if you have any 1 or 2 comments to complete the take-home message, please go ahead.
No, I think, sir, a lot of gray zones was discussed during the panel discussion, and gray zones will remain gray zones. So it remains to a certain extent the personal outlook towards the situation.
All right.
I have just a small question. If you
please go ahead.
Yeah, what is the status of if a patient willfully gives you a good testimonial and with all consent and everything, either written or video or audio? Are you okay with sharing it on social media?
Absolutely. If the patient has given written consent, whether it is good or bad comments, of course we can share it.
Right.
In fact, I suggest that when the patient is leaving your clinic, your assistant or the person who's sitting at the door should give them a tablet and say, please write your comments on social media.
Right.
Okay, right at the time when they're leaving. And if they are doing it from their own account, then it is voluntary and it is obviously documented as voluntary. So there is no problem.
Yeah, because I have patients who want to give video this thing and for posting on YouTube and stuff about their experiences with cancer and other things.
Yes.
Yeah.
Excellent. So please, just as a last word, there are legal implications, there are ethical implications, and there are moral implications. Today, what we have discussed is less on the legal side and more on the moral and ethical side. So the bottom line is, a rule of thumb is that if I am doing something with which I will be able to sleep peacefully at night, then it is morally and ethically right. And I think that is the best way that I deal with my dilemmas that I have in day-to-day practice. And I thank everybody for a patient hearing, active participation. I thank all the faculty, especially Dr. Amy, who's our international keynote speaker. And of course, Lupin for sponsoring this session, and Kavina Creations for doing the webinar so nicely. And I now request all of you to have a nice dinner and a good night. And Kavina Creations can end the meeting. Thank you very much.